someone was working with someone with muscular dystrophy. They were asking about pranayama and other things, but I realized we had never talked about this on these calls anyway. So I'm not an expert, I don't spend all my time working with this condition, but I've definitely had clients. What's interesting, so basically, your muscle cells lose the ability to function is what you kind of need to know. So it's like a slow kind of progressive condition for most people. There's different kinds of muscular dystrophy, but the thing to know is basically that a lot of muscle structures turn from muscle to fatty tissue. So it's like they sort of convert from a useful, muscle that can fire to fatty tissue that is just sort of sitting there, so you lose function. And I looked around for some studies this week, and there's not really many good ones. There's like very small anecdotal studies, and sort of the couple I found sort of pointed to 40% of people in these really small studies getting benefit from movement. So what I kind of look for in those studies, which isn't always obvious, is, how many people got worse. And the answer in this case is it didn't really change any outcome. So clearly asana and breathing is a useful in that it'll either help or not hurt someone. So it's definitely worth a try. I think Karina was working with somebody on, you can read that in the forums. Karina was working with someone, and she was mentioning that she had employed Mula Bandha, and he could definitely sit up straighter. But the other technique I've used in the past is sort of prana nidra type techniques, where you have people basically visualizing and breathing in and out of the limbs. And that has brought people, it's all subjective and anecdotal, but that has worked in the past with people I've worked with. So I was just working on the theory, if you get more prana flowing, then things are going to get better physically. That doesn't always work, but that's what I've employed. So that's one technique. Another useful technique is retentions after the inhalation and growing those more. Again, as a more like energetic, you don't really have to teach people how to mitigate stress necessarily if that's not what they're experiencing from their condition or their life. So I've gone the other way and sort of done breath retention as a way to kind of juice up the system, and that has worked. And when I say worked, it has, clients have reported feeling better, having more energy, possibly light amounts of less pain, and also light amounts of, or I should say low amounts of better functioning and effective limbs. So that's what's happened for me. Not everyone, I would say. My anecdotal experience is that it helps like more like 75% of people I've worked with, but again, the numbers aren't big enough to call that science. So just some thoughts on that if you get someone with muscular dystrophy. And there's different types, and they affect different areas of the body and sort of progress in different ways. So it's a condition that I would say is a bit underserved. People kind of often give up on people because it's a really hard condition to work with. So if you get a chance to work with someone with muscular dystrophy, definitely take it.